Thank you for joining us for another episode of Watson Clinic Health Talk. If you've read your local news lately, you're probably already aware that there's a new hospital coming to town, and it's being brought to you through an affiliation between Watson Clinic and Orlando Health in the summer of 2026. And on that same campus off Lakeland Highlands Road in South Lakeland will stand two additional Watson Clinic facilities, a medical office building featuring a number of our most popular specialties, and a state-of-the-art ambulatory surgery center for outpatient procedures. Here to discuss all of this and more is Jason Hirsbrunner. He's served as the Chief Executive Officer of Watson Clinic since 2022, and he's obviously a key figure in ushering in one of the most ambitious periods of our 85-year history in the community. Please note that there are moments in our conversation when we refer to the MOB and the ASC. These are abbreviations for Medical Office Building and Ambulatory Surgery Center. First of all, thank you so much for joining us today. This is great.
I appreciate being here. Usually I like to keep these reserved for our physicians, but I do appreciate that we've got some interesting things going on in the Lakeland community. So I appreciate the opportunity to talk to you and hopefully a few of our patients.
Yeah, we've got really important stuff to discuss today. But before we get into our affiliation with Orlando Health and our new facilities and all those exciting announcements in recent weeks, tell me a little bit about your journey. So you arrived at Watson Clinic in 2022 from Illinois, correct?
That's correct. So I worked for a physician-owned multi-specialty group, very similar to Watson Clinic, a little smaller than Watson Clinic in Champaign, Illinois, called Christie Clinic. I was there for 15 years. I kind of worked through a various degree of opportunities in the clinic. I started out as the business manager for our outpatient pharmacies. We had two outpatient pharmacies, and I really worked on, competing with the Walgreens and Walmarts of the world in their generic prescriptions and got us to a place of competitiveness to keep a hold of our patients and their prescriptions. And then I moved into a director level role that was really more around support services, our continuous improvement efforts, becoming more efficient in the work that we do and how we do it. And then I collected some sundry other departments, marketing, facilities, helped build some facilities or oversaw the construction of some facilities. And then the last 8 years that I was at Christie, I was the chief operating officer. And so I guess that caught the eye of Watson Clinic. They were smart. They had the recruiter call me in January in the middle of winter in Illinois and asked if I was interested in talking to a group in Central Florida.
Right.
And I think my wife said yes faster than I did.
Well, that's amazing. I mean, so you have all of this experience from all kinds of different diverse vantage points in the healthcare industry. So when you come with that experience to the Lakeland community, what did you observe of our community and of Watson Clinic's place in it?
I tell you, it really was from when I started interviewing people, and I interviewed quite a few, or they interviewed me, I guess, or a little bit of both. What I was amazed about was, number one, the longevity of some of the staff that we have at Watson Clinic. And I'm talking generational, where, my mother works there, and now I work here too. And so that's super impressive to me, that it wasn't, it had a culture that wasn't a revolving door. And the ability to keep that going was very enticing to me, number one. Lakeland, in and of itself, I was amazed at the generosity of this community and the philanthropic nature of it. And again, just kind of the pride that Lakeland has in some of its institutions, but also the way that, I guess, the reverence that this community still does talk about Watson Clinic and what it meant to them and, their healthcare needs for their parents, their grandparents, and now them.
Yeah, absolutely. I mean, almost 85 years.
Right.
We've been serving this community. So we have a proud history, but the future, we're experiencing this unprecedented growth in this area. And I'm wondering your observations in terms of Watson Clinic's place in that and how we're preparing to respond to that growth.
Yeah, whereas where I left, there was an out-migration in Illinois. So it was about maintaining your market share to the best that you could, and sometimes that meant trying to take that market share from somebody else. Whereas I walked into an opportunity here at Watson where we can't keep up with the demand. And so I think some of that we fight internally is that discussion around, how do we continue to grow to meet that demand? I think everybody thinks they can see one or two more patients, but being strategic about, what are those areas, what are those service lines that we need to be specific and have a real plan for not just organic growth that we naturally have, but a strategic growth, because that's the where the population's going, and kind of, to quote Gretzky, skate where the puck's going to be, not where it's at now.
That brings us to the latest announcements that we've made that our community is very excited and intrigued by, which is the affiliation we've formed with Orlando Health in the construction of a new hospital in South Lakeland, the Orlando Health Watson Clinic Lakeland Highlands Hospital. Tell me what we mean by affiliation, because that term is confusing to some.
Right. So the affiliation really it's a 50-year affiliation that could be renewed, probably past my tenure. But really, when it comes to an affiliation, we're not supposed to say partnership because that has legal ramifications, right? It's attached to it. But it really is an opportunity for a physician-owned healthcare institution, multi-specialty group like Watson, to have a community partner in a hospital. So many of our specialists see our patients inside their hospital, and to truly have a collaboration when it comes to, the seamless transition between the inpatient and outpatient. Watson's a very adept with our diagnostics. We do a lot of work on the outpatient side to try and get to the root cause of what may be happening with a patient. And so having those services available to our physicians, our hospitalists, or our surgeons, or whatever it may be inside of that hospital is something that we've not necessarily had. And so the affiliation is really about making sure that those patients are taken care of seamlessly in both sites of service. It allows us to have our name on that hospital because we have an affiliation. So I think that's something that most physician groups don't get the chance to do unless there's been an acquisition of some sort. And on that note, this is not an acquisition. Mm-hmm. This is two groups coming together with an idea of how healthcare can be delivered in Lakeland and Polk County. And then putting some construct around that, some framework around that would allow us both to, have a win-win situation.
And I'm glad you made that clear, because a lot of people said online when we made these announcements, Orlando Health bought Watson Clinic, and that's absolutely not what's happened. They came to us with this idea, and we joined forces on this one particular hospital.
I think one of the things that, I'm very connected with the physician-owned groups throughout the country, right? Whether it be through, some of our Stratum Med that we're a part of, or AMGA or MGMA, any of those other, affiliations. And a true collaboration like what we've built here is very, very rare. A lot of times, whether it be a physician group that's in trouble and they go to the hospital system to be bailed out, whether it be a predatory hospital system that comes in and, makes an offer that, quote, you can't refuse. But this is different in the industry, nationwide. There really isn't a model like this where a large health system like Orlando Health truly collaborates and does what they can to maintain the independence of a physician-owned group and not just acquire them. Mm-hmm. So to your point, there were a lot of, there were a number of health systems that are interested in putting things up in this community, new hospitals in this community, and we've talked to all of them, and most of those conversations were very short because, Watson Clinic wanted to maintain their independence, and any deal with either of those other institutions wouldn't allow for that, like Orlando Health has.
Yeah. And it was very smart of Orlando Health to approach us because we have that foothold and relationship to the community. And so I think it's going to be a wonderful collaboration. Also on that same campus, we've announced that we're building a medical office building and an ambulatory surgery center. What can you tell me about the plans for those?
Yeah, so the whole idea is that our surgeons and proceduralists, their day can obviously vary based on the type of patient or the type of work that they have to do for that day. So they're outpatients someday. Someday they're on-call inpatient and taking what needs to be done inside the hospital. And then there's a lot of work that's done electively that can be done at an ambulatory surgery center. So currently we have an ambulatory surgery center on Florida Avenue around the LRH and Watson Clinic campus, and we're going to maintain that. But so much of the market is moving towards some orthopedic cases being done now electively on the outpatient side of things, same day total hips, same day knees. And our current facility really just didn't allow for that in an efficient way. It wasn't built for that back in 1996. So we're really wanting to ensure that our patients have that available to them in this community, because it's really not been. I mean, there are some other orthopedic groups that have come into the community that have freestanding ASCs, in the Tampa market or around us. And so having one available to our patients in Lakeland is really important. And having a hospital partner that wants those patients outpatient as well. If you don't need to be in the hospital, nobody wants to be there. So having those proceduralists be able to park their car to start their day and really have available to them within walking distance, their office, their outpatient surgery center, and the hospital to round on patients or do something emergent need in the hospital, and then get back in their car and go home whenever their day's over. That's really important. That's really important for our physicians. We're hoping that it's going to be really efficient for our patients to know that, it's not tomorrow morning, because I literally could stop in once I get done with the case over here. I can run across the street and see you in the hospital and make sure you're okay, and really be able to seamlessly see their patients wherever they need to be seen, and then go home and not spend any windshield time.
That's so true, because what it gives the patient is, and the physician, it's flexibility and easy accessibility. So our medical office building will house a series of specialties, some of the most in-demand specialties. And then if outpatient surgery is a possibility for some patients, they go to the surgery center. And if they need the hospital instead, it's right there.
Right.
You can have all your medical needs met on one campus for the most part, I would imagine.
That's the hope. I mean, I do think that, one of the benefits of Watson Clinic is because we do have the depth and breadth of specialties that we like to believe that we're a one-stop shop. Mm-hmm. And I think having that campus available to us just kind of furthers that hope, is that, you can come see your pre-op visit and park in the same parking lot and go to your surgery center and then go home later on that day.
And in terms of its locale, South Lakeland, Lakeland Highlands area, what thinking went into that?
Well, I think, again, that's where a lot of the growth was at that particular point in time. And it was available space right off a very busy drag within Lakeland. And so having something there for the hospital on the south side of town, my hope is it complements what we have available here on the north side of town, and helps patients get to where they need to be. If you need an emergent need, you're able to get to that hospital much sooner than you would have been able to earlier. But that's really, we went where the growth was going to be. Yeah. Obviously, we have our Highlands medical office building on 540. We're right off the Parkway with our urgent care on South, in our South facility. So it really triangulates great, so that our patient population really can, again, have the medical campus that they've been able to enjoy on the north side of town available to them on the south side of town as well.
So you mentioned orthopedic surgery. Are there other specialties that we've noticed with this increased population growth are also becoming more in demand?
Oh, man, they're all in demand, right? I mean, with the population growth that we had, not everybody moving in is a physician or a technologist or something along those lines. But GI is definitely in demand as the recommendations change that you should go for your screening colonoscopy earlier. When they brought that down to 45 years old, that just opened up a whole new amount of patients that need our services nationwide. So GI definitely, urology is going to be in that building, and we have a demand for them there as well. General surgery continues to be, very busy, and depending on what people need, in demand too.
Yeah, and people hear that term physician-owned, and Watson Clinic is a physician-owned group practice, physician-owned and operated. What are the benefits of that structure to the patient?
Well, I think, our physicians, like any industry, when you meet the owner and the owner is really proud of what they built, it provides a better experience, right? When I go to 1961 and I meet with Marco and talk to him, it's a better experience because this is his blood, sweat, and tears. And now we've been here for 85 years, so there's a lot of blood, sweat, and tears that a lot of physicians have put into Watson Clinic. But I'll tell you, each one of our physicians, when they become a partner and they become an owner of the group, I think it provides a little bit of a different flavor for that patient-physician relationship, right? Just like it would be as I'm a customer, going out for dinner. And so, that's a really important thing for our patients. Our physicians understand the value of each individual patient. There's no flat, rate that they get paid, for showing up that day, like a salary. They really are incentivized to, see the patient when they want to be seen, when it's convenient for them, and really, understand, quote, the value of the last patient of the day, and really try what they can do to work their patients in. And I think our patients feel that and notice that as well.
Yeah, I think those are great points. And the care a patient receives is determined entirely by their medical professional, the person that knows them. Right. I mean, that they trust.
What we do every day is protect and enhance the patient-physician relationship. At the end of the day, that's the value we provide. Right.
And those physicians and providers will be staffing the new hospital.
Yeah, for those service lines that are in our wheelhouse. I mean, there are certain what I would consider subspecialties that we don't necessarily. That's not in the bread and butter of the outpatient side, whether it be neurosurgery. Obviously, the ER physicians are going to be Orlando Health physicians. But those specialties that our patients see us on the outpatient side of things, they will be there at that hospital.
There was concern that this new campus might impact our Highlands location somehow.
Our Highlands location is really a lot of primary care. Yeah. Our ENT is going to stay down there. OBGYN will move. We want them to be closest to the.
And it's just down the street.
Well. And it's just down the street. I mean, it's a 5-minute drive from there, depending on stoplights and whether school is letting out or not. But the Highlands facility. Our hope is that we continue to be able to backfill any vacated space by those new providers we're going to need to take care of that hospital. Some of them will be located in the MOB, but we're going to need to have some of those subspecialties that Orlando Health's going to provide, like maternal fetal medicine. They're going to need to have some outpatient practice as well. And so our hope is to be able to lease them some space so that no matter where they go in Lakeland, if they need a specialist, it's either Orlando Health or Watson Clinic. It's kind of maybe an expansion of the campus, but really, evidence of that affiliation and that partnership.
Where do you see this community and its healthcare representation? Where do you see it in 5-10 years? Are we going to continue to grow? Is it going to plateau? Is there?
I think, a lot of the growth, there seems to be a little bit of a healthcare deficit in Polk County to the east side of Lakeland. So I think, that Auburndale, Winter Haven, I think there's a tremendous amount of that growth that Lakeland felt over the past few years has now went over there. So I think you're going to feel a lot of that pinch. And so hopefully the collaboration between Watson Clinic and Orlando Health will allow some unique opportunities as well to try and fill some of that deficit too. I think, I wouldn't necessarily say Lakeland's plateaued. We still have a lot of places being built. But my hope is that, we'll now have options and we'll have access. That really is the big thing. We need access for people to be seen when they want to be seen and when they need to be seen in a timely manner.
I agree. What does the construction look like? Have you walked through there?
Well, obviously, you can't go anywhere near that without seeing the hospital from miles away. So, it's impressive on that campus for sure. And right now, with the medical office building in the ASC, we are still on pace to be open that same time. I mean, the infrastructure of a hospital or the inside of the hospital is a little bit more intricate than what we're trying to put up. But I was just talking to our facilities director today, and the tilt walls are being poured for the medical office building and should start to go upright within the next 10 to 15 days. So we'll start to go see vertical on our campus as you drive down Lakeland Highlands Road in the next couple of weeks.
That's incredibly exciting.
Yeah, it's very exciting.
So, I mean, this is an obvious question, but how do you feel? We've talked about the 85-year history of Watson Clinic. How do you feel about its future?
Very bright. I think, this collaboration with Orlando Health provides opportunity for us that really aren't available to a physician-owned group, right? When you talk about a viewpoint of how do we collaborate together as opposed to how do we compete. So I think the opportunity to both of us do things very, very well that the other doesn't do. And so if we can continue to leverage that as we grow together and provide those options and access for the community, I think the opportunity for Watson Clinic is very bright, one that we haven't seen in a long time.
That's it for this episode of Watson Clinic Health Talk. If you'd like to keep up to date on the upcoming hospital and medical campus, visit us at watsonclinic.com/OH or follow us on any of the major social media platforms. And if you like what you've heard in this episode, consider subscribing to our podcast. Go to watsonclinic.com/podcast to learn more. Thanks for listening.